Welcome back. So that's a quite a personal question, but I don't mind answering that. So for many transgender people, especially those who have had gender affirming surgery, sexual function and the ability to experience pleasure or an orgasm can remain intact or be restored, although the experience can vary. Many trans men who undergo bottom surgery, whether it's metoidioplasty or phalloplasty, can still retain sexual sensation, especially if they had hormone therapy. And one of the things that does is it enlarges the clitoral tissue. Sensation in these areas may allow for sexual pleasure, though individual experiences vary depending on factors like the type of surgery and personal healing. Trans women, those assigned male at birth who transition to female, trans women who undergo vaginoplasty often retain the ability to experience sexual pleasure and orgasm, as the nerves from the original genital tissue are preserved during surgery. Over time, many trans women regain or maintain sexual sensation after healing. Ultimately, the ability to experience orgasm or sexual pleasure is highly individual and can depend on factors like the type of surgery, healing, personal anatomy. It's always important to have open and honest discussions with healthcare providers to understand the outcomes of different surgical procedures, including expectations around sexual function. The ability to ejaculate depends on the type of transition a transgender person undergoes and their individual anatomy. So trans men, after starting testosterone therapy, many trans men experience an increase in clitoral size and sexual arousal, but they do not produce ejaculate in the same way as cisgender men because they do not have prostate glands or balls, which are responsible for producing semen. Even with bottom surgery like metoidioplasty or phalloplasty, ejaculation is just not possible, as those surgeries do not create the internal structures needed for semen production. If a trans woman has not undergone gender-affirming surgery and still has testicles, it may still be possible for them to ejaculate, though the volume of ejaculate might decrease after starting hormone therapy. That would be estrogen and anti-androgens. Hormone therapy significantly reduces testosterone levels, which typically leads to a reduction in sperm production and ejaculate. For trans women who have undergone vaginoplasty, that's bottom surgery, ejaculation is no longer possible, as the testes are usually removed during the procedure. In summary, while ejaculation in the way cis men experience is not possible for trans men after transition, trans women may experience a reduced ability to ejaculate depending on their hormonal and surgical transition choices. Both may experience sexual pleasure, though the way this is achieved and the actual sensation will depend on a number of factors or something along those lines. Again, hope that answers your question. Thanks for watching. Stay safe. Don't forget to like, comment and subscribe. See you next week.